Medicare is a federal health insurance program in the United States that primarily serves people aged 65 and older, as well as some younger individuals with certain disabilities or serious health conditions. It was created in 1965 as part of the Social Security Act to ensure that older Americans would have access to affordable health care. The program is funded through a combination of payroll taxes, premiums paid by beneficiaries, and general government revenue. Medicare consists of four main parts: Part A, Part B, Part C, Medicare Advantage, and Part D. Each part covers different aspects of healthcare. Medicare Part A, hospital insurance. Medicare Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and limited home health care. Most people don't pay a premium for Part A if they or their spouse have paid Medicare taxes for at least 10 years, 40 quarters. Part A is often referred to as hospital insurance and covers services such as hospital room charges, meals, and nursing care during an inpatient stay. While Part A covers many inpatient services, it doesn't cover everything. Beneficiaries may face out-of-pocket costs like deductibles, co-insurance, and other fees after a certain number of days in the hospital or skilled nursing facility. Medicare Part B. Medical insurance Part B covers medically necessary services like doctor visits, outpatient care, medical equipment, and preventive services like vaccines and screenings. Unlike Part A, beneficiaries must pay a monthly premium for Part B, which is income-based. Most people pay around $164.90 per month as of 2024, but higher-income individuals may pay more. Additionally, Part B has an annual deductible and co-insurance, meaning that beneficiaries are responsible for a portion of the cost of services. Part B is essential for covering routine healthcare needs, including preventive care and diagnostic services like blood tests and imaging. It also helps cover durable medical equipment like wheelchairs or walkers. Medicare Part C, Medicare Advantage. Medicare Advantage, also known as Part C, is an alternative to original Medicare, Parts A and B. These plans are offered by private insurance companies approved by Medicare. Medicare Advantage plans provide all the benefits of original Medicare, and many also include additional coverage, such as prescription drugs, dental, vision, and wellness programs. Medicare Advantage plans often come with lower out-of-pocket costs compared to original Medicare, but they typically require beneficiaries to use a network of doctors and hospitals. Some plans also require referrals for specialist visits. The cost and coverage options for Medicare Advantage plans vary, so it's important for beneficiaries to compare plans based on their healthcare needs. Medicare Part D, prescription drug coverage. Medicare Part D provides coverage for prescription drugs. Part D plans are also offered by private insurance companies and help beneficiaries pay for both generic and brand-name drugs. The plans vary in terms of premiums, deductibles, and which medications are covered, formulary. Beneficiaries can either enroll in a standalone Part D plan or get drug coverage through a Medicare Advantage plan that includes it. While Part D is voluntary, there may be a penalty for enrolling late, making it important for individuals to sign up when they are first eligible. To be eligible for Medicare, individuals must meet one of the following criteria: age 65 or older. Most people qualify for Medicare when they turn 65 if they are U.S. citizens or permanent residents. Under 65 with a disability. Individuals who have been receiving Social Security Disability Insurance, SSDI, for at least 24 months are eligible for Medicare. End-stage renal disease, ESRD. People with permanent kidney failure who need dialysis or a kidney transplant can qualify for Medicare. Amyotrophic lateral sclerosis. Individuals with ALS qualify for Medicare immediately upon receiving SSDI benefits. While Medicare helps cover healthcare costs, it is not free. Beneficiaries are responsible for various out-of-pocket costs, including premiums, deductibles, and co-insurance. Part A. Most people do not pay a premium for Part A, but there are deductibles and co-insurance for hospital stays. Part B. Monthly premiums for Part B are required, along with an annual deductible and co-insurance, typically 20% of the cost for most services. Part C and Part D. The costs of these plans vary depending on the provider and plan chosen. Beneficiaries should consider premiums, copays, deductibles, and covered medications when choosing a plan. Medigap is supplemental insurance that helps fill in the coverage gaps of original Medicare, Parts A and B. Medigap policies are sold by private insurance companies and help cover out-of-pocket costs like deductibles and coinsurance. These policies are only available to those enrolled in original Medicare, not those using Medicare Advantage plans. Medicare is a vital program that provides healthcare coverage to millions of Americans, primarily those aged 65 and older. Understanding the different parts of Medicare and the associated costs is essential for making informed healthcare decisions. Although Medicare significantly reduces healthcare expenses, beneficiaries must consider additional coverage, such as Medigap or Medicare Advantage, to help manage out-of-pocket costs and ensure comprehensive care.